My name's Steve Luter, and I'm a Vietnam veteran, 3 Purple Hearts. I've been coming to the VA here in Palo Alto for about 20 years, and by and large, it's been A-plus care. I do not have any disability claims against the VA, but I want to thank Congresswoman Speier especially for identifying and unjamming the roadblock we had in Oakland to getting people for their claims. You know, mine is a very small issue, but it may affect other people. The Office of Patient Advocate. I had a bit of a problem about 2 years ago accessing some care that I needed or thought I needed immediately. I went to the Office of Patient Advocate, and it became very clear to me that that was a listening post and not an action post. Their job is to listen and diffuse issues, but it seems to me if it were my VA, I would empower that Office of Patient Advocate to do something, to actually make some phone calls, cut through the red tape, and get the person the care that they thought they required. Like I say, it's a very small issue on a very big plate here, but I think I am not the only one who has had this experience with your Office of Patient Advocate. And it's not the person sitting behind the desk, it's the job description. It's very clear, and I don't think they should intervene in medical decisions, but getting somebody to the proper place when the need is urgent. Now, I offered to go through, I said, well, you know, if you can't get me what I want, I'll just go to the emergency room, and I know I'll get what I want. Now, it's my understanding that emergency care is the most expensive way to dispense medicine. That's where the overhead is. So, if you could empower or redefine the job description for the patient advocate so they can cut through some red tape, I would be grateful, and there may be other people in this room would be grateful too. Thank you very much.
Thank you. Sure. And if I could address that, so the patient advocate does have scheduling access. They can see when appointments are available. I apologize they weren't able to help you in your particular case, but they do have that ability. And I want to go you one better, because in my ideal, you wouldn't have to come to the patient advocate office, where whatever clinic, whatever service you were not receiving ideal service from, we are trying to empower 100 service level patient advocates. I'd like to have 1,000 service level patient advocates so that, you know, we solve the problem at its root cause at the source. And, you know, it's much, I readily admit it's much easier for staff sometimes to say, you know, there's a patient advocate up in the director's office. Go up to her office, go tell them and they'll take care of you. But, you know, if every staff member at every level is owning what is in front of them and empowered, as you say, to solve that problem, that's the kind of healthcare system we're striving for. But thanks for your comment.
Thank you. Mike?
I got a couple of comments. One, I've never experienced any wait time. The first day I enrolled, I think I was seen right then. Two, in the 15 years I've been here, I've had nothing but superior, absolutely excellent care and monitoring. And really important, as far as I'm concerned, is the VA, Palo Alto VA should be emulated across the country. And apparently, is that what Lisa Freeman is assigned to do?
Freeman is trying to survive the next 120 days.
If that's your assignment, we're home safe. The whole country is home safe. A single concern of mine as a volunteer in the past is, I don't think it's just VA, I think it's general, is I've seen people who should be allowed to die. We just make them keep breathing, and that's not keeping them alive, it's torturing them. And I'm confident that's not a VA problem. It's just we as a society don't let us die.
Thank you, sir. Michael?
Hello, I'm a Vietnam veteran also, and I'd like to address the homeless issue in medical care. It seems like the system for homeless veterans isn't really set up for a homeless veteran. They assume you have a telephone, they assume you have access to the internet, everything is done electronically, everything requires a telephone, and not just any phone, you have to have a smartphone to access the services. And then we're right in the middle of Silicon Valley, and I don't understand why you guys are still tied to this Windows thing. Why don't you move to Linux and Unix? It's free. Linus Torvalds lives right up the hill over here. He's the guy that wrote Linux. You know, he immigrated to the United States. And why is the homeless program under HUD? The VA's homeless. You need to separate that from HUD. You have guys that have been to prison for some of the things that HUD don't like. They're homeless now, and they're from my peer group. We have a disproportionate number of people that have been incarcerated for drug crimes and sex crimes. And I know they're not popular, but, you know, they served honorably. They should be treated as a veteran. They shouldn't be treated, you know, as the lowest scum on earth. I was homeless for 3.5 years. Ms. Spears, I called your office several times and left a phone number and was never contacted. And some of these things are the same things I was complaining about when I got out of the service in 1975 and lived in Atherton to Leo Ryan. And, you know, we're still talking about them. And it's unacceptable.
Well, it's unacceptable that you didn't get a call back. I do have top-notch staff that responds to every case that comes in the door. So $4 million have been returned to veterans in veterans benefit claims through my office on disability claims. So I want to make sure that you connect with my staff, Richard Steffen and Mark Nagalis, and we'll get to the bottom of it. So you left a message on a voicemail.
No, I talked to several of your staff members several times. And,
all right.
You know, at your local office. And then I know an 800 number that puts me through to the Capitol switchboard that I use to call your Washington office. And I never heard nothing back.
Well, what is it you want?
Well, I've taken care of that issue. I'm not here to talk about my personal issues. I'm just talking about veterans issues, you know, the things that I have noticed since I've been back in California.
Okay.
You know,
well, I still would like to know, I would like you to talk to them because I want to find out why you didn't get the satisfaction you were looking for. Okay?
Okay.
Thank you.
Oh, and
He's going to come around to you right now.
I do think that there's an important issue embedded in what the gentleman is raising, though. And that is, it sounds as if the VA system is geared toward all of the electronics that most of us use, except homeless people don't have access to that. So how do you maneuver through that community, understanding the things that the gentleman pointed out?
Yeah, I think we have an outstanding and amazing director of our homeless program here, Ms. Kate Severin. And, you know, I would really like to get into, as Congresswoman Spears was talking about with your particular issue, if you know of a veteran that is finding that as an impediment, because the mantra of our homeless program is, you know, we meet every veteran where he or she is, whatever their circumstance is. There is no one size fits all, and we have amazingly dedicated, creative staff that will go the extra mile. They have really embraced the service improvement model. They have, what was the times, Kate, something like gone from over 100 days to lease up time to under 40. You know, just
right here.
Yeah, just amazing improvement work, and we don't want any veteran to feel that, you know, they have to have the right technology to have their needs met. So we want to meet those unique needs of every veteran every time in that homeless program. And if you know someone whose needs we have not met, let's get with you and take care of that. Thank you.
Lisa, to that point, do you interact with all the homeless shelters in both counties? So that, I mean, having spent some time in a homeless shelter in San Mateo County and actually spent some time with a veteran who actually had gone through your Menlo Park program for services, he clearly had access to a phone at the shelter, but I guess the question is, how do you reach those who aren't in a shelter?
Right, and it's probably a unique answer to each veteran's circumstance, you know, but I do believe that our staff, they wouldn't say that we couldn't serve someone because they didn't have a phone or they didn't have an address, or, you know, of course they aren't going to have an address, so they take great pains to meet every veteran's individual circumstance, one veteran at a time.
Lisa, would you like me to say anything about the housing resource?
And also that sign out front, you know, the one that's got the quote from Abraham Lincoln. What about the widows? Hey, it's like the healthcare system is closed to service-connected widows. And they're not taking any new patients. When they kick them out when they're 65. And I thought that was the other part of the VA, that, you know, you were here for those that had borne the battle, our widows and our orphans. And the widows are...
Thank you. Kate, did you want to say something real quick?
I mean, I'd be happy to say, I appreciate that comment. You're absolutely right. We do have additional barriers in reaching our homeless veterans. One of the things we've done in the last 3 years is add, thanks Michael, we have weekly housing resource groups in the community, in shelters, soup kitchens throughout our territories. In VA Palo Alto, we have 10 counties in our catchment area. So once a week at St. Mary's, Tuesday morning in Stockton, thank you Mona, is when a veteran, anybody could go and get information about housing or any of the resources we have at VA Palo Alto without an appointment, without waiting. So St. Mary's, I mentioned, you can go to the Emergency Housing Consortium in Little Orchard, Tuesdays at 9 a.m. This is every Tuesday we're there. And just about each day of the week, but there are 10 different locations every week. We try to post these flyers wherever we can because we recognize those issues about getting information. Well, where are your housing resources? When can we go? We try to post these wherever we can, and as we do outreach throughout our catchment area, soup kitchens, detox facilities, libraries, police stations, etc.
Thank you, Kate. We have a lot of great comment cards here, ranging from medical marijuana to our new secretary. We will get to these questions, and what we'll do is we will post these on our Facebook page. So all the questions that we can't get done today, we are going to make sure that you're going to be able to see them up, and we'll have them up.
But they need to be answered too, though.
Not in social media. Can you put them up on a website where you don't have to be a member of Facebook to see them?
We can put them on our website as well.
Yes.
Yeah,
Yes.
Sure.
I mean,
Sure.
Yeah, we can do that.
I don't want a
Yes.
social media footprint.
Okay, Michael.
He's right.
Do you have a question?
Hi, I'm Dr. Joe English and I practice in Menlo Park. And in 1999, Congress authorized full implementation of chiropractic services within the VA medical system. It's been 15 years and there's still 100 medical facilities that do not offer this service, including there are none in the Bay Area. And back pain and musculoskeletal issues is the #1 issue from VA research from our returning veterans.
Particularly in Afghanistan and Iraq.
Yes, and they need this care. They need non-drug, non-surgical options. And I don't think a lot of veterans understand that this is a mandated service that they're eligible for, and they can't get it here. And
Now they can get it through us through a consult, and we fee it out all the time.
okay, but you don't have anybody on staff here, correct? Right.
Defer to Drs. A.J. Coy. I think we have some types of chiropractic care that we can offer through in-house providers, but I don't know the details of it. But the chiropractic care is available.
There's 2 congressional bills currently. There's H.R. 921 and Senate Bill 422, and both of these bills authorize full implementation of chiropractic care within the VA system by 2016. And I hope you both congresswomen will support these bills, if not co-sponsor them, so our veterans can get the care that they deserve. Thank you.
Thank you.
So, if we could allow Dr. Ajay Koy actually has the mic and he can address some of those questions too.
So we completely agree that there should be a lot of non-intervention, non-opioid treatments for back pain, which would include chiropractic care, which we don't actually currently offer, but we in-house, but we do offer through fee basis. We do offer acupuncture as one of the adjuncts to pain management. We do offer that both in-house and on fee. We're actually currently working with our team of our physical medicine and rehabilitation, our neurosurgeons, and physical therapists to put forward a more comprehensive form of treatment, which will allow more self-care as well as more care at the hands of the primary care providers, which will be at all of our sites. We're also working with some of our colleagues in the community, such as Palmer Chiropractic College, to see how we can better integrate these services. So it is a work in progress, but certainly something that we are aware of the need.
Doctor, can I ask you a question? So chiropractic services are essentially outsourced?
Yes, they're sent out on fee basis.
And you said, but what does that mean on a fee basis?
So-
Does the VA pick up the tab for
Yes,
that?
so
Okay.
we pick up the tab for whatever
But
fee
why
con-
would that be the case when 15 years ago or whenever the Congress mandated this service?
So Congress
And
mandated that chiropractic services had to be provided at one VISN facility. And the Northern California healthcare system actually has a chiropractor on staff there. The service is available through all facilities. With our 10 sites of care, we have not wanted to centralize services only at one site, and that being able to being able to take advantage of the community resources means that we can actually provide the service closer to where the veterans live.
So how many do you have in the community services for chiropractic care now?
So we actually can use any.
No,
well, right now-
not how many providers there are. How many veterans are making use of that now?
I don't have that number on the top of my head, but
You know, along the same lines, you should know that there is $4 billion in the federal budget for care to be provided to veterans who want to go outside of the VA system and go to a private physician. That's existing law. As a result of the scandal that has been uncovered at sites around the country, that amount of money is being increased dramatically. So anyone who can access care in a timely fashion through a VA hospital can access care at a private facility or a private provider.
And I would just say that in the last 10 years, 25,000 veterans have availed themselves of this service. And it was from veteran demand that Congress created this in 1999. And I will say also on the fee-based service, I have colleagues that commented that it is very difficult to get reimbursed from the federal government for chiropractic care. It's almost not worth it. And that's just a problem that doctors have in getting reimbursed on an outside basis for our chiropractic services.
Because they think the fees are too low, or the
It's
reimbursement
just,
is too low, or
it's
because the process?
it's just
It's just
the
the process itself.
of getting reimbursed and all the hoops you have to jump through to get paid. And it's very
Kind of
difficult.
the mark of the whole healthcare system in our country, not just the VA.
That's true too.
All right.
This should be better.
Yeah.
Good afternoon, everyone. My name is Don Davidson. I'm a Marine Corps veteran and a volunteer here at the Palo Alto VA. I really don't want to go through the whole thing because I don't want all y'all to cry, but I went through so much pain at this facility trying to get hip replacements. 6 years I went in excruciating pain, praying for death every night for 6 years because I needed hip replacement, and the waiting list here at the VA, phew, we don't even want to go there. Cause y'all know, if you ever been on a waiting list, it ain't no joke, okay? 6 years of pain I went through, when all I had to do was go to Stanford and get a new hip. I went to Stanford, I got a new hip. 6 years later, went back to Stanford, got another new hip. Last year, I got another new knee. But why does a veteran have to go to Stanford to get the services that's supposed to be provided here? Okay? With all the great doctors that the VA, the military produces, right? I ain't got nothing against Stanford doctors, because I had a good one, Dr. Daniel Lee. But without my permission, y'all transferred him away, so now I don't know who I got. Okay. But to make a long story short, that's too much pain and suffering to put somebody through for a waiting list. And that's inhumane. I've sent letters to Mrs. Eshoo about this issue with my service. Like the other gentleman, I never got a phone call. But I still love you, and you still got my vote.
Thank you, sir.
So, Lisa, let's talk about hip replacement, knee replacement.
Sure.
How is that done?
So I credit the Chief of Staff's office and the whole executive team that certainly, right now there's a lot of talk about outpatient clinic appointments and primary care and mental health and specialty care appointments, but procedures is right behind that. And for years, we have acknowledged here that we've had issues with procedures. I think everyone knows here that Stanford is our primary affiliate, so our service chiefs, our clinical service chiefs are also Stanford faculty, so we have a really close relationship with Stanford. We recognized last year in looking at our waiting times on knee replacements, on hip replacements, on other types of procedures that we needed to take action. So we set aside some funds, and through a very thoughtful relationship that we have worked through with the Stanford Department of Orthopedics, I think we had a very successful relationship in having hundreds of patients referred to Stanford in coordination with us so that their pre-op care, their post-op care, their medications, the documentation of what occurred when they had the procedure at Stanford's facilities was all within that VA medical record. Same thing for their OT and PT, so a full coordination of that. That's what we need to do more of, working with our partners, whether they're our affiliate or other partners, to meet these demands. Now, that did take a good chunk of additional resources, but I think that's what the VA is struggling with right now is, they've already discarded the 14-day time as being too aggressive for primary care, specialty care, mental health appointments, routine appointments. But what is the right number? What is the right time? There aren't ready standards in the community for any of these things. But our commitment to you is that we want to see where we're having the issues and to get better at it and work with our community partners if we can't provide that service in-house.
Well, two questions. The gentleman that just spoke, his care was provided at Stanford, but it was paid for by part of the Veterans.
That's what I don't.
Veterans Administration, or not? Can you tell us?
It's got to come out of Hip National Bank. Okay. That means I got to come up with the money some kind of way. But it was worth it. I got no pain now.
No, I know. I'm thrilled
every
that
night.
you're feeling well. I just want to know more about this journey and how it's being handled for other people.
Well, I got God on my side. I hope the rest of y'all, because you put it on the VA. Ooh, boy.
Lisa, that raises kind of an interesting point. The Inspector General has done a series of reports. One back in 2005 that dealt with the delays in appointments. So this isn't actually all that new an issue. It's been going on for a while. But one of the statements he made to me was that there aren't any standards within the VA in terms of how many patients a physician should see a day or how many colonoscopies a physician should do a day. And so there's no means by which you can create the standards that exist, for instance, in a Kaiser, where a Kaiser physician is expected to see 15 to 16 patients a day and do X number of colonoscopies a day. So it sounds like if we're really going to make the system work optimally, standard performance criteria has to be created. Have you created anything locally in that regard?
So let me just talk a little bit about, let's just take primary care, and Stephen can correct me if I'm wrong. So our panel size for primary care is about 1,200 patients, right? So there's something called a glide path, an access glide path that is looking at every provider who has a panel of patients and how effectively are we meeting that 1,200 per provider standard, to just talk about something very simple.
But is it your own standard or is it a
That's
national
that's
standard?
a national standard for the VA, okay? They have started this year through an inspector, I believe might have been through an IG inquiry, looking at productivity for providers. But I do think it's a very complicated issue because, as you both know very well, the more you do, the more parts and pieces of a person that you touch in the private sector, then the more you get paid. And we know that's what's wrong with our healthcare system, because we want to treat the entire veteran. We want to be providing the veteran their health that not just is addressing parts and pieces, but your health and well-being for the rest of your life. We want to own the patient for the rest of your life, that we are taking good care of you, and that is much more complicated. Having said that, I think that there aren't those standards nationally at this time, but as I just described, with if 14 days isn't the right standard, the VHA is struggling with what is the right standard, and first for outpatient appointments, then for procedures, then for lengths of stay, other standards, they aren't set yet.